Hi, it's Angie with News OK. I am here with Dr. Paul Wright, who is a family doctor, and you have you're aware of a study that has been done recently for people over 65, and they're noticing maybe cold weather affecting people over 65 having higher blood pressure. Tell us about this study.
There's an interesting study done in France, actually amongst 3 cities, and the authors of the study aligned it so that they followed blood pressure for these people over a few different seasons and saw a correlation between times of year, temperatures, and their blood pressures, tending to go up higher blood pressures in the colder months and lower blood pressures in the warmer months.
Oh, wow. Okay. So what would you say would be a reason maybe for that?
It's hard. The study authors themselves couldn't exactly tell us a reason why it occurred, but they did notice this was a significant correlation. It wasn't just by chance. And so now we have to try to dig down and find out why. It makes us more aware that our seniors especially ought to be more careful with their blood pressure medications, adherence to that, and following the blood pressure up with their doctors on a regular basis, especially in the colder months.
Yeah, definitely. And obviously, like you have mentioned, that it may not be a cold, hard fact yet, but there's obviously some kind of relationship there. So for our family members who are maybe over 65, making sure that they're either taking their blood pressure medicine or looking for warning signs and stuff like that, what would you suggest that we do?
Well, if they're on medication, they should always be making sure to stay compliant with the medications, getting a chance to get it checked at their doctor's office or at home if they have their own blood pressure cuffs. Warning signs for bad things that happen with high blood pressure are most importantly those for stroke and heart attack. And we want our family members as well as our patients to be aware that if there's signs or symptoms of a stroke, and we try to pass on some simple ones they can remember, there's any kind of changes in their speech that they slur, they feel like they can't move one arm or one hand or something, or they're stumbling and they're walking all of a sudden with a sudden onset. Those are things to look out that could be associated with stroke. And then heart attack, we have our classic symptoms of some chest pain or sweating, a pressure sensation that they feel on their chest. Warning about those. But most importantly, a lot of the times it's that they just don't control their blood pressure over long terms, and this is one of those periods that they ought to make sure they're following the advice the physician's given them.
Definitely. And what would you advise then for people to do, since we have lack of sun in the winter, people aren't out as much. Like you said, we're not getting that vitamin D. So what would you suggest that all of us do, but especially people over 65 during the winter months?
Well, in keeping yourself healthy overall is one thing. You should be eating good regular diet with vegetables. The amount of vitamin D we get is decreased because we get some of that to the sun, so we ought to be looking at ways to supplement it in our diet. We actually recommend that most women over or past childbearing age and in menopause are taking about 1,400 milligrams of calcium daily and about 800 units of vitamin D. And that often has to be done through a supplement because you can't get quite all of it in your food. Okay. Men benefit from the vitamin D also. We don't know all the areas yet that vitamin D is going to show up as an important vitamin to add to our diet, but eating a good regular diet, avoiding things that can increase your blood pressure like extra salt. We all like to eat out, and unfortunately people that eat out are unaware of how much extra salt gets placed into their meals. But it's heavy there, so be careful when you're eating out. When you're eating at home, not adding extra salt. Be aware that canned foods often have high salt contents. And the regular exercise that you maybe were able to do in the summertime because you're out and able to get around without having to worry about the weather, try to find some places that are safe and can be indoors. Do it. If you can go outside and brave the elements a little bit without hurting yourself, that's also good for you to do.
Definitely. Well, thank you so much. So it's about being aware and also taking care of ourselves, maybe paying a little more attention during the winter months.
Definitely.
All right. Thank you so much.
Thank you, Angie.